Hello, everyone, and welcome to Back Chat. Welcome to Yogaberry, your yoga for scoliosis community. My name is Christine Jaregiberry. I'm a yoga teacher and I specialize in yoga for scoliosis. And I do this sort of talk every Wednesday. It's afternoon for us here in the UK, but it might be morning if you are somewhere else in the world for you. This is an interactive show. Obviously, you might be watching this on a replay, you might be listening to it, but if you are here live, you are more than welcome to get involved and to ask any questions. Yes, let's make this show about you, about your questions, and let's make it really, really relevant for you as well. So today I've got another interview guest, and her name is Beth Terranova. She is a physical therapist based in the US, and she is a Schroth therapist as well. So she will be able to tell us a little bit more about Schroth therapy. And our topic today is actually strength training. So this was something that always comes up, and people always ask me about this. And as I said, I'm a yoga teacher, so it's something that I'm trying to bring in a little bit more into my practice because especially as you get older, I'm sure Beth will talk about this, it becomes more important, but I would not consider myself to be an expert in this field at all, which is why I'm going to bring Beth on here today. So, welcome. Thank you so much for taking the time to talk to us.
Thank you so much for having me, Christine. It's great to be here.
Yes, great to have you here. And we've connected on Instagram, and I did put Beth's Instagram handle down there as well. So feel free to connect with her, and she does post some great tips as well. So for today, I'm going to ask Beth my questions. There have been loads of questions already beforehand, which I'm going to ask her as well. But if you are here live, come and say hello. I will keep my eyes on the chat. This is when I'm looking to the side. That's what I'm doing. I'm not being distracted and doing something different. I am checking if anyone has got any questions. Let us know where you're tuning in from today. This is a community, and we are really international. There's people from all over the world, and you never know who might have some resources for you as well in your area. So make sure that you're getting involved. But back to you, Beth. Um, why don't we let's start with your scoliosis story. So before we kind of get into more of the exercise part, why don't you tell us a little bit more about your relationship with scoliosis?
Sure. So I was diagnosed probably around the age of, I want to say 12 or 13. I had a pretty mild curve when I was originally diagnosed, about 10 degrees. And when I went back to the doctor for a follow up a little bit later, it had progressed to around 30 degrees, but they determined that since I had stopped growing, I wasn't a candidate to be braced or do therapy or anything. So basically, the recommendation was goodbye and good luck. This is your life now. And there was no like education as to what scoliosis was, what it meant for me um, growing up. So it was interesting. I had just started high school, and the doctor had given me a letter that I needed a second set of textbooks. And at the time, I was playing soccer. So I had all my soccer gear on, and I walk up to the librarian and I ask for my second set of textbooks. And she said to me, "But Beth, you play soccer, you do all these things. Why can't you carry a textbook? Why aren't you able to do this?" And I thought about it and I said, "Well, I've had scoliosis now for a few years and I'm still being active, I'm still playing sports, and it hasn't really changed anything for me. So maybe it's not something that is such a big deal as I thought it was, because it was never explained what it really was."
Hmm.
So probably about my sophomore year in high school, I was competing in track and field. And my track and field coach said, "Beth, I feel like you would really improve um, in your track and field." I was doing the pole vault, which is I know it's a very rare sport for people to do, but I had seen it in the Olympics. I said, "I'm a pole vaulter." And but my coach said to me, Beth, you would jump much higher if you started weightlifting. And he was
Right.
already involved with weightlifting and weight training. So I went down to the gym. I weighed like 100 pounds, and I went in and I like was lifting this tiny little barbell, and I started weight training. And my mom freaked out completely and was like, "What are you doing? Your scoliosis." Ah.
Right.
So she brought me back to the orthopedist, and the orthopedist said, "Well, what are you?" I said, "Well, I picked the bar up on my shoulder, I put it up over my head." I showed him like some of what I was doing, and he said, "You know what? You're done growing.
Hmm.
If it feels good, go for it." So I went on, I competed in the Olympic style of weightlifting, which I don't know if people are familiar. When you watch the Olympic Games and you see weightlifting, that's I competed here in the US nationally
Wow,
for
amazing.
many years.
Hmm.
And I actually placed as a junior, which is here is 20 and under, um, in the top three for two years in a row. And I had a long career. I recently retired, more so just because I wasn't competing as much anymore. I was more so just doing it recreationally, and my career was kind of taking a priority. But I competed in weightlifting for 13 years and actually recently had an x ray, and my curve is exactly the same as it was when I was diagnosed as a teenager. It stayed at that 30 degrees. So it's been quite a journey there.
Mm, amazing, amazing. Yes, and that is so interesting also that you said in the beginning that your mom uh, got a little bit worried because there's this thing, there's this anything finishing with the is, scoliosis, sounds really scary, right? And our first kind of reaction is, should we be doing this? Can we, are we going to hurt ourselves? Um, so I just wanted to go back to kind of your doctor said obviously it was fine for you to do the weightlifting. Would you say if somebody is younger, and now obviously you have this experience of working with lots of people that have scoliosis themselves, would you say that younger people who are still growing, that there might be a little bit more of a risk? Should they kind of stay away from the weight training, or what would you say?
There's two sides to the coin. So one is we know that the progression of scoliosis is related to some asymmetric loading
Hmm.
of the spine as the teenager is growing. Um, and that's one of the principles of the Schroth method, is to work on trying to get in the best possible alignment to encourage that more symmetrical loading so that the curve doesn't continue to grow and progress.
Right, right.
But one of the caveats I would say is that, especially in our teens that are being braced, we know that they may lose some bone density
Hmm.
as they're being braced because they're not getting that natural gravity and weight on their curve. So I feel that there's a trade-off between the two. I would say that supervised weight training in a good corrected posture should be safe, but it has to be very well monitored. And if that person is being braced, they need to get right back into their brace once they've completed their
Afterwards.
activity. So
Mm.
generally, I recommend sports without limitation. The weight training, if that's really something they want to do, needs to be a little bit more carefully monitored. And I would recommend that person probably um, work with a coach that's going to watch their form at all times and make sure that they're not showing signs of progression or leaning more into their curve as they're doing their weight training.
Yes, yeah. So that's a great point, and I see some similarities to the way that I teach and practice yoga as well, um, because it's the same thing, isn't it? We learn our autocorrections, we get to know our posture, our curvature, and once we have this, then we can take it into pretty much anything, right? And we can do all the movements really that we want to do. But in the beginning, it might just take a little bit of tuning and setting up, I guess is what you're saying, isn't it? Good. So how did you get So you were doing all your Olympic sports and all of that, which probably kept you really busy, I would imagine. How did you get into the Schroth therapy and physical therapy in general?
Sure. So I had a little SI joint injury at a national weightlifting competition, and I ended up in the medical tent. And the person there, he explained to, I said, well, what is it that you do? Like, what is your, he was explaining to me, oh, this is your pelvis, this is your, and I said, what is it that you do? He said, oh, well, I'm a physical therapist. I work with people who have injuries. And from there, I said, oh, this sounds like what I really want to do, because I knew I wanted to work in the medical field, but I was a little less inclined to become like a physician because I wanted to spend really time with my patients and
Hmm.
really, get to know them over the long term. So I came back to college and I switched my major pre physical therapy. And that was it. So I finished my DPT in 2015. And when I started working in a hospital, and this hospital in Manhattan Columbia Presbyterian had just opened a spine hospital where they had some surgeons that did spine corrective surgeries. So Dr. Lenke, who in the States is a very well-known surgeon, Dr. Lehman,
Hmm.
um, they had started doing scoliosis surgeries there. And I said, oh, this sounds very interesting. So I asked to rotate into that department. And when I saw some of the cases that were going for surgery, I had learned a little bit about the Schroth method in PT school because our director of my program actually was trained in the Schroth best practice.
Okay,
So
excellent.
we had learned a little bit about it in school. And when I saw kind of um, the patients that were coming in for surgeries, I said, I feel like Schroth could have really helped them.
Hmm.
If they had the access to Schroth therapy before, or maybe even, at when they were diagnosed, et cetera. And I was like, how is it that I never heard of this, that I was never sent for Schroth therapy. So when I moved into working in more of an outpatient setting, I went for the training here in New York, in the Barcelona Schroth method, and it blew my mind, and it completely changed how I looked at myself as well, because there
Right.
were so many things that happen day to day or even in my lifting that were unexplained to me.
Mm.
Like, how come every time I squat, it's hard for me to keep my pelvis central?
Hmm.
Why do I watch my teammate, and they never seem to really have a problem with that? It wasn't explained to me ever that that is something related to scoliosis, that can be corrected by working more on core strengthening and hip strengthening. So I I learned a lot from becoming a Schroth provider, not only about my patients, but also myself.
Mm. Yes, yeah, absolutely. It's so interesting. I mean, most of you who know that that I'm a fan, and I am from Germany, so I feel like I'm close to the source. And one of my cousins actually growing up, he was going through the Schross therapy in Bad Sobernheim. But it's really what I find fascinating is that it was kind of invented such a long time ago, in a way, and it's one of these things that was purely developed for scoliosis, right? So all these, I don't know how many, it must have been 100 years now, I guess. I don't know when Katharina Schroth, yeah, that's it, isn't it? Beginning
I
of
think it
the
has to be. Yeah.
20th century, I think. So yeah, and it's just been improved and developed over time, and yeah, I've definitely seen, and it really helped me with my yoga practice. And I still think that it's not the same at all, and um, it's not this or that. It's kind of it's another a way of getting the information, and then you can use this, as you say, for your strength training. I can use it for my yoga, but it's super super beneficial, and really there's, as you say, there were so many things that clicked, just kind of understanding a few things, and especially about rotation and hips. I feel is something that nobody ever explained to me, certainly, definitely. Good. Let me just have a quick look at the chat before I ask you my questions. So Liz is here from Yorkshire. Hi, Liz. Annalisa is saying, hi, Christine and Beth. Tatiana is here. She's saying good morning. Laura is here from Buenos Aires. Kathy is here from Canada. So everyone's here. Fantastic. There's somebody from the Philippines as well, and somebody from Burma. So there you go. We've got a few people watching us today. So let us know if you've got any questions for Beth as well. So let's start with some of these that came in before. So we talked a little bit about, the problems maybe that there can be with weightlifting, but maybe you can go into a little bit more detail. So somebody was asking, does the weightlifting affect the curve negatively? If you can kind of
So
give us a bit more on that.
absolutely. I would say that, of course, this is coming from my experience, and I haven't seen any research that says that weight training progresses or, can be a detriment to someone who has scoliosis. In fact, if we consider the research on osteoporosis and some other issues that people with scoliosis deal with, we know that weight training is important for those clients, right? So that they can build their bone density. And we
Yes.
know that actually osteoporosis has a link to scoliosis progression. So I would say almost the opposite, that weight training is a benefit for
Mm-hmm.
people who have scoliosis. Now, there are some caveats, of course, and I think that, I'm not encouraging everyone to become an Olympic weightlifter. That is not my intention. I would
Yes.
love to. I do have some friends who are power lifters, who are bodybuilders, and they have 50-degree curves, and they are unbelievably, actually, I don't know if you know this, Christine, one of the world record holders in powerlifting had a 50-degree double curve
Oh, wow. No, I didn't know that.
scoliosis, and he
Yeah.
deadlifted 5 times his body weight,
Wow.
which to me is amazing.
That
And
is
I always
amazing.
reference that when people ask
Uh-huh.
me, because it's so great. But I absolutely think that weight training is safe for people with scoliosis. I
Mm-hmm.
absolutely think that, as we've discussed, knowing your curve and knowing your postural correction is very important.
Mm-hmm.
So, something that I work with my clients first before I start weight training with them is I teach them how to align their body properly. And with every exercise that they do, I make sure that they're maintaining that alignment to the best of their ability. So, I think that it's important to strength train, but it's also important to have someone who can teach you about your curve and monitor what you're doing, so
Mm-hmm.
then you know that you are working in a good alignment. I think what happens a lot of times, and maybe why people stop strength training, or is because they don't understand how to align their posture, and then they
Mm-hmm.
end up feeling more tension in their prominence
Yes.
because they are leaning over towards that side whenever they're lifting, or they're doing their workout routine.
Mm.
So I think that is truly a fundamental aspect of uh, starting a strength training program with scoliosis, and that's
Mm.
something that I work on a lot with my clients initially to start.
Yes. And sometimes also, I mean, especially for those that maybe for who this is completely new, um, as you say, you don't have to be an Olympic weightlifter. And sometimes we think, it's going to be this really muscly type of people that are lifting. It can be something that you can do at home, right? And you can just start very small and then start to build it up. I just wanted to ask you before I go back to my chat, which is where we've got lots of questions coming in. Um, what about people who have had a fusion? Is there anything that they should kind of be mindful of?
Um, yes, it's interesting. I actually have spoken to a few people who have fusion who are weight training. One of my friends who's a bodybuilder had a Harrington rod
Mm-hmm.
fusion. Actually, she saw an improvement in her curvature when she started weight training. Again, it's a similar idea that the weight training is used to stabilize the muscles around the fusion.
Mm-hmm.
Because what I find a lot of times is that if people are not strong around their fusion, those are times when perhaps, we may run into some people have their rod break or, something in that case. So I think it's important to strength train to help support any surgery, but especially fusion. Um, I would recommend those people to focus on strength training that's done in a straight plane and not to, I mean, I would say the majority of my
Uh-huh.
clients, I work in a neutral spine position. I work in a
Yeah.
straight plane. I don't do rotation strengthening. I don't do like, you see people doing the twists with
With the
with a
weight. Yes.
ball,
Mm.
right? Or they're doing like side, like going over to the side this way in order to strengthen. I tend to encourage things that are done all in a neutral posture, and I feel like that gives us the best load. So for someone with fusion, I would give them the suggestion to work in neutral posture.
Mm-hmm.
Start out slowly by building up their core strength and stability first, and then when they start moving into standing activities, to really learn the proper way to hip hinge, right? So what I find is a lot of my clients who have fusions, when they don't have mobility of the spine, they have to find that mobility of their hips.
Yes. Yes.
And I encourage a lot of exercise that involve hinging from the hips in order to build strength there so that they're not hinging through their fused areas or their unfused areas, which may become areas of more movement if they are not properly stabilized.
Mm. Yes. Yeah, exactly. And that's a good point. Not every fusion is the same. Obviously, sometimes it could be the whole spine, or sometimes it's just kind of parts of the spine. What about kind of load when they take the arms up over the head? Um, just because I have seen some people with spinal fusion that find this already quite difficult. What about if you then put weight on it?
Right. So it depends on their mobility, right? So if
Hmm.
they're fused in the thoracic spine, we know that when you lift your shoulder, you do need some motion of the thoracic spine in order to get overhead, right?
Yes.
So if they don't have the proper mobility, I may adjust the exercise. So one variation I really like for that population is to do an incline press. So where they're supported on a bench, leaning back in order to lift
Hmm.
so that they don't have to use that motion of leaning back. And I actually work with a weightlifter who had a thoracic fusion. And for him, it's very hard to get that overhead position. And what we've worked on a lot is his shoulder mobility
Yes.
so that his shoulders can make up the difference of the motion, and a lot of stability work of the scapular stabilizers, the muscles that help to support the upper back, because when they do the fusion, they do have to cut through some of
Mm.
that area in order to get to the spine. They cut through some of the smaller muscles. So it is important to strength around that area. But if someone has trouble with overhead motion, I would encourage them to do an incline motion where they're supported,
Yeah.
or a horizontal motion where maybe they're lying on their back or on a bench where they can still get some upper body strength training without feeling as if they're straining into their upper back.
Yes. Yeah, that's a good point. Um, Good. So let me just go back here and see. So Kathy is saying, do you recommend that people get an X-ray if asked to work one-to-one? Do you generally ask for an X-ray?
I do. I mean, I think that comes from my Schroth training that I like to look at the x-ray. But generally, if I can see a picture of the client, in most cases, I can classify their curve
Hmm.
based on their standing alignment. There are some cases actually in adults with scoliosis who develop scoliosis later in life that it's a bit more challenging to identify based on their posture.
Yes,
So in those cases where
compensate. Yeah.
I'm a little bit puzzled, I may ask for an x-ray.
Yeah.
The other important thing, Christine, that I want to know about is if they have a listhesis,
Mm.
because having a lateral listhesis, meaning having a vertebrae that is very rotated and almost moving away from the curvature, I may want to start that person with a little bit more stability work in a supported position before I get them into a true strength training program. So I do look for that
Yes, yes,
on
and
my
this
clients.
is I do come across this as well quite a lot. So it sometimes goes hand in hand with scoliosis, isn't it? And it's yeah, it's good to know this. Um, right. So Tatiana is asking if you can show some exercises from Schroth, which is probably not that easy to kind of quickly demonstrate. Um, but maybe we can come back to that if you've got, you know, some exercise tips for us towards the end. I just want to make sure that we get to all these lovely questions here before we get into that. Good. Is there a role for doing different weight repetitions on each side depending on your curve? So in other words, would you work in terms of the weights, would you work asymmetrically with people?
Generally, I don't, and part of the reason is because many people will have an S curve. So I feel that if you're training, one side, you're training the thoracic curve. If you're training the other side, then you're training the lumbar curve. So I know
Hmm.
that there are some schools to think like, oh, you should only side plank on your thoracic prominence side, or your lumbar prominence on your thoracic prominence side, because you need to strengthen those muscles there. Generally, I still have my clients do both because I like
Mm.
to try to work both sides. If I see a big asymmetry in strength, let's say someone who has a pelvic shift and I notice a big asymmetry in their hip musculature, I may encourage them to do a little bit more strengthening on one side or the other.
Yeah,
Generally, I haven't found the pattern yet to say if the pelvis is shifted this way, then this hip is weaker. We're actually doing research on that
I know.
here in New York
Uh-huh.
to find out, but unfortunately, everything is shut down. So we haven't enrolled any participants yet. But it is my goal to see, is there a relationship between the alignment of the pelvis and the musculature of the hip strength?
Mm.
So generally, I don't. I do a lot of exercises that are loaded bilaterally, and I feel that that allows the client to um, use their own stabilizers. When I do unilateral exercises, I do, in the most case, do this both sides equally. But it, of course, like we said, it depends on the client.
Yes, it always depends, doesn't it? Um, good. So this was the same about the same question. Right. There was another question about exercising, strengthening the core. So we already kind of you touched on it a little bit when you were talking about the lateral listhesis as well. Um, Tell us a little bit more about kind of the importance of core strengthening, and maybe give us some tips on what we can do in that department.
Sure. So generally, when I think about core strengthening, I like to uh, strengthen in four different planes, right? So one example would be an anti-extension, which would be like a plank, because if you think about, if you just relax yourself completely, your back would stick out like this if you were planking. I also like to do an anti-flexion, meaning the body being pulled forward, maybe by doing a deadlift or something of that mechanism, where the person has to hold their back straight against the weight pulling them forward.
Right.
And then also anti-rotation exercises and side bends. So like a side plank would be an example of something you could do for side bend strengthening,
Hmm.
and a Pallof press holding a band would be an example of something you can do that was anti-rotation. So I have some of these videos on my Instagram. I did a feature in June for Scoliosis Month with many different exercises that one could try for core strengthening. But interestingly enough, there is research to say that just by doing squatting, just by doing a lot of these exercises that you wouldn't necessarily consider to be core strengthening,
Hmm.
if you're in a good alignment, your trunk muscles actually do work and your core does strengthen that way. So even maybe doing lunges, doing exercises where you have to balance yourself more in a way, or if you're balancing on one leg and you're doing something, and like a single leg deadlift is one that I
Yes.
use a lot with my clients who were working on their balance as well. Um, so I feel that a lot of those different options are ways that you can strengthen the core. And to keep it interesting, I think a
Mm,
lot of people may get frustrated with core strengthening because it's boring, and I'm just
yeah.
staying in this plank position for 60 seconds. And, if I feel if you're able to make it a little bit more interesting and more challenging, um, people tend to be a little bit more excited to do their core
Mm.
strengthening work.
Yes, and variety is good as well at the end of the day, isn't it? I feel like if you always
Hmm.
do the same thing, your body just gets used to it, and it becomes so automatic that you're not really learning anything anymore.
Right. Right. And just by using a free weight or something to that, I know a lot of people will feel more comfortable using machines or things like that because there's a stationary aspect to it but even if you're using a free weight and you're doing it safely and supervised, using a free weight, you have to stabilize more in that case because you're working against something that has a little bit more of a variety in how it moves.
Mm,
Whereas a machine just works on uh, an axis, so you're always kind of working that same axis. So
yes.
any free weight training that the person feels comfortable and able to do can also be strength training. And I don't mean, like, again, I'm going to emphasize that doesn't mean squatting 300 pounds. That may be as simple as sitting to a chair holding something that weighs a few pounds to start. Whatever that person's starting level is generally where we meet and create their program.
Mm, yes. Yeah, that's a good point, isn't it? We'll definitely all check out your Instagram as well and get some exercise tips there. Um, Good. So Annalisa is saying, thank you for answering the question on fusion. Good point on the hip strengthening. I'll focus on this. I agree that raising my arms is already demanding with fusion. So thanks for the great tips. So there we go. Thank you.
Glad I can help.
Rudy Lee is saying, can strength training help cure scoliosis if done right? Also, what about swimming and sprinting? Thanks. Great question.
It's a good question. Yes. Um, I never, Christina, I'm sure that you're feel this way too, but I never guarantee a cure for scoliosis because I feel that, I need to be honest with my patients that some of scoliosis is inherently in our bones
Hmm.
and how we develop. So, I never give 100% to say a cure for anything, Schroth, even weight training included. But I will say that I have seen occasions where, for example, I have adult clients who have a curve that actually does improve slightly. And the improvement is not necessarily that the curve is um, reducing, but what's happening is their postural muscles are helping to support more their curve and their alignment becomes more balanced, meaning
Hmm.
that when their trunk lines up more over their pelvis in a good alignment, it's actually a better outcome and a less risk of progression. So I've had cases where the person is leaning way over to the side, and then by strength training and learning their postural correction, their curve is the same, but now it's a little bit more balanced.
Yes.
So I have seen those cases of maybe a 5-degree improvement, a
Yeah.
mild improvement in the Cobb angle, the measurement that we use
Yeah.
of scoliosis itself, more so related to the muscle activation and being able to stabilize around the curve.
Hmm.
Um, in terms of swimming and sprinting, that was another one.
Yeah.
There is a school of thought to say that though sprinting is good, especially for teenagers because they get kind of the ground reaction force when they're
Mm-hmm.
running, and that helps with their bone density. So especially if they're being braced, sometimes people will recommend them to run and to be active. In terms of swimming, I do like swimming as a cardiovascular exercise. I think one of my maybe pet peeve is that there are many physicians that will say, you have scoliosis, just go swim. And I feel
We've
that,
all heard this, I think. Let us know if you have
I
heard this. I have.
and I understand. I understand their concept is that it's not loading the spine and that the person can still get some exercise. But if you're not a swimmer, and then to say, okay, now go be a swimmer
Hmm.
because you have scoliosis, it doesn't make the connection to me. If someone is a swimmer and they enjoy swimming, and that's great, continue to swim. It's the cardiovascular benefits are great.
Hmm.
But I think in terms of the improving scoliosis as something that is anti-gravity, right? So our curve, uh, we respond to gravity's pull on our curve. And that's actually how part of why we think, people shrink as they get older, because gravity wins as over time and we get a little bit smaller. So I do like to incorporate exercises where people are working against gravity. So as I do like swimming as an exercise, I do tend to, if someone is a swimmer, I would encourage them to do some additional strength training
Hmm.
outside of the pool in order to work on those postural muscles as well.
Yeah, yeah. Great, thank you. Um, Good. FluTube is saying, loving the show today. Excellent. Thank you. Would it be possible to do the Schroth method treatment for a client virtually? Another great question.
Hmm. So, this is a little bit of it's a challenge because it depends on your comfort level as a therapist. So,
Hmm.
part of being a physical therapist is that we are licensed and this is in the States. So, it may be different. I'm not sure if it's different for Europe. Maybe you would know more, Christine, but
Hmm.
um, so we're licensed by state. So, if I'm working virtually with a patient in a physical therapy capacity, they have to be located in the state that I am licensed. So, for Schroth, since that is considered a physical therapy treatment, then that person would have to be licensed in the particular state that I'm treating in. Um, I do know there are some Schroth therapists that maybe are a little more lenient on this. And I guess that depends on what their laws are where they are. Maybe
Mm.
in different countries might be different. But I do use the Schroth principles in some of my fitness work. And I think that's what many of us fitness professionals do,
Yeah.
is that we take the principles of the correction,
Hmm.
of the alignment, and maybe some of the breath work, and incorporate it into our particular niche or whatever we're doing with our clients. So in terms of a fitness capacity, or even maybe an educational um, standpoint, I do work with people virtually to educate them about their curve and maybe teach them some simple fitness exercises with the Schroth
Mm.
spin on it. But in terms of doing Schroth therapy virtually internationally, I haven't really done that yet, just because of the limitations of the licensing.
Right. But otherwise, you would say it's possible. So if somebody is in your state but can't get to you, you would be able to do it
Yes.
via video as well.
Right. And I
Yeah.
do have many people reach out to me looking for Schroth therapists.
Mm.
And a good way to find one is if you go on the Barcelona Schroth website or the Schroth Best Practice website. They have listings if you find your country or your state, and they list out where you can find a licensed Schroth therapist. So
Right.
many people I will refer them to someone who's in their state to
Right.
do
Yes.
video sessions with.
Yeah. Because so I have taken some Schroth therapy sessions virtually before, and there is some. It's great, and you learn a lot, but there's still a little bit of limitation, obviously, because they cannot touch you, and I guess also, because everything is so precise, and sometimes quite, I guess, you have to be able to look at things from all sides, really, isn't it? So sometimes Meredith, who I was working with, she was saying, "Oh, I wish I could just kind of reach through and help you." So
Right,
it's
right,
always, if you have the opportunity, obviously it's always best to have someone there with you in the room, but sometimes that's just not possible, isn't it?
right.
Mm.
And as Schroth therapists, many of us are very hands-on in
Mm.
cueing, expand through here or lengthen through here. And like you said, when you're doing that via video, it can be very challenging to give the cues. And also that, the Schroth exercises involve a considerable amount of setup with
Yes.
um,
Mm.
with belts and padding and um, setting up. So that's why I encourage people, if they are interested in learning the exercises of the Schroth method, that they do work with someone who is a provider, because if you're just looking online and using other patient setup, this may not be for the correct setup for your curve, where your apex of your curve is, where the pad should be placed is very specific to each client.
Yes.
So I would definitely recommend the person to reach out to a Schroth therapist to get the training before they start setting anything up from what they've seen online.
Yes, absolutely. It's all so individual, isn't it? And the more I work with clients as well, it's just every scoliosis curve is different, and there's always different nuances to it, isn't it? Right. Let's see. Hi. Are weighted squats bad for someone with kyphoscoliosis? Weighted squats.
I'm not sure if they're asking of a barbell like weighted on the back, or if they're talking of, there are different variations of squat.
Yeah.
So
Yes. I
um
would
I
imagine
would
that's what
say
they mean, isn't it?
that they
And
mean,
yeah.
yes. So I haven't found anything to say that it is a contraindication. In fact,
Mm-hmm.
I do barbell back squats as part of my training.
Mm-hmm.
I'm very strict, and I monitor my technique. I had a coach for many years to make sure that I was doing them correctly. I don't necessarily think that they're a bad thing, but I think that it's important, again, to be um, work with someone who can give you feedback and make sure that you're aligning correctly. Um, and realize that there are some inherent asymmetries that you may see in your squat from having scoliosis.
Yeah.
There is a degree to which we can correct those with proper cueing, but there is a degree to where some of that um, may be part of your particular um, technique. And so I do work with lifters who have scoliosis. They compete in lifting or powerlifting, etc., and they may have some asymmetries in their lift based on their curve. For them, they progressively loaded over time their lift so that their body has adapted to those changes in weight. I think where some people go wrong is they start loading up the weight too quickly before
Mm-hmm.
they've really learned the technique. And that may be where it can be a little bit dicey if you're
Yeah.
someone with a kyphoscoliosis. But it's interesting because in the barbell back squat, you do have to keep your chest up as you're going. So if you have a kyphoscoliosis where
Yeah.
maybe you're a little bit more rounded, it may actually be a good exercise for you to try. I would
Right.
recommend maybe starting out with a stick or a broomstick or something that's very light initially,
Mm-hmm.
so that you can learn the technique properly. Um, I have a client now that we had originally done some goblet squat where you hold the weight in front so you don't have the bar directly on your back. And actually, she does better when she has the barbell um, on her back. Now, she's working right now with a stick, and she will build up gradually. But I think those are important things to remember, that you can learn something, but it needs to be gradually progressed so that your body can adapt to it properly.
Yes. Yeah. Absolutely. Um, Good. Right. Where did I get up to? I'm following Hayley Lombard on YouTube. She does lifting and she has a 90-degree scoliosis. Have you heard of her?
I've seen her. Yeah, I follow her as well. Yes, she does. She does more of like a bodybuilding type workout where she does more like circuits and that training, and I think it's great. Like, she has a big following and she really inspires a lot of people to weight train. And
Mm-hmm.
from my understanding of her story based on her posts, that weight training has helped her significantly
Mm,
in terms
yes.
of her pain and her alignment, etc. So,
Yeah.
yes,
And
I
Eva
love seeing
Butterley
that.
is another one. She's from Ireland, and she's
Yes,
another
and
one.
she has a fusion. or she
Yes,
had a
she
fusion.
had a fusion. Yes, I think it was taken out in the end, but she has got quite a very significant scoliosis as well. You can tell.
Hmm.
And yes, she has really built up her muscles, hasn't she?
Hmm. Yes, absolutely. And these are all case, I mean, these are all case studies, but they're all examples of how you can weight train safely. And I'm sure that these people didn't, they built it up over time and they did what they felt comfortable with and didn't just jump into something, you know, where they were lifting heavy weights right away. It was
Mm.
gradually built over time. And that was my story too. I started with just 35 pounds on the barbell, putting over my head until the point where eventually I got to 185 pounds. But that took
Well,
over 10
35
years of
sounds enough
time.
for me.
That took many years of time. It
Yeah.
wasn't like in a few days. And I think that's where you can see the progress if you really dedicate yourself to trying.
Mm. Yes, absolutely. Now, are you okay for time, by the way? Just have a
Yes,
couple of
I'm good
questions.
for time.
So I wanted to touch on osteoporosis a little bit. You mentioned it a couple of times, um, especially for those of us who are kind of pre or post menopause. Can you maybe talk about this a little bit and how the strength training can be um, beneficial, I guess, for those?
Sure. So with osteoporosis, we know that the body responds to the demands that are put on it.
Hmm.
And, part of one of the big important parts of a treatment for osteoporosis is weight bearing exercise. And I think many people misinterpret it as just walking or just, being upright and doing something. It In order to really see the bone density change, you need to apply some weight to the muscles need to act, and that pulling of the muscles on the bone is what helps to increase the bone density, and the bone will respond to that loading by increasing its density.
Right.
So there was an article recently where they compared two groups, and one group did like a traditional PT exercise for osteoporosis, which was maybe doing some work with bands, some table exercises, some gradual, small band work or lightweight things. And then the other group actually weightlifted. So they squat with a barbell, they deadlifted with a barbell, and they pressed with dumbbells. And the group that did the weightlifting, they learned the lifts over like a 4-week period. And then they started training on a program where they gradually increased a few pounds each week. The group that did the weightlifting program had larger improvements in their bone density than the group that just did kind of the traditional PT exercise
Hmm.
group. Um, so, in terms of care for osteoporosis, I know some people are afraid because they say, if I lift weight, could I fracture?
Yeah.
And really, that's only in a very severe osteoporosis where maybe the T score is like in a 4, or very high um, risk of fracture case, right? So
Hmm.
that person would need to be monitored more closely in terms of weight training. But those who are maybe osteopenia or osteoporosis and maybe a beginning stage, absolutely weight training. Oh my gosh, I have a client right now and she is with dumbbells doing rows, and she is wearing a backpack with some weights on it going up and down the stairs. Things simple as this can make a big difference in the bone density. And even just doing the little, this is something new I saw, is doing jumping, plyometric, doing little
Yes.
jumps in place to get that ground reaction force
Yeah.
has also been shown to help with bone density as well. So I have this
Yes.
client, she's going up and down stairs with the backpack full of books. She's jumping in place. She's doing her dumbbell training and she
Yeah.
loves it. And it's helping her significantly.
Skipping as well, isn't it?
Skipping, I heard. Yes, absolutely. Absolutely.
Good. Lovely. Thank you so much for sharing all of this. I know we could probably talk for hours, but you do have a lovely guide as well, haven't you, for strength training? So just tell us a little bit about this, and it's in the people can find it in the description as well.
Sure. So it's a free guide, and it's chock full of information. I'm excited, and I hope that people do learn from it. It gives a little bit of a background to why strength training is important for scoliosis. It gives a quick um, education on curve
Hmm.
type and different types of curves, and then it gives a little idea of how to set up your posture before you're going to start a weight training program, and a very quick idea of an example saying like these exercises for upper body, these exercises for lower body, these exercises for core. So I think it's a good starting point for anyone who, you know, wants to start strength training, who has scoliosis, is not really sure where to start, and wants to learn a little bit more about that aspect. So I of course, it's just a guide, it's educational, you know, it's not meant to treat in any way, it's not meant to diagnose, it's for people to learn a little bit more and maybe
Hmm.
get started on something. But of course, you know, there's a big disclaimer there. If you're, you know, if you need extra help, of course I am here
Yes.
to help you, so please reach out if you're maybe a little scared or don't know what to do. It gives you a little background, but it's not meant to be kind of like a end all be all. It's a little bit of educational guide. So I
Yeah.
hope that people
Yeah.
download it and it gives them some ideas on how to maybe just get initially started.
Get started. Yes, absolutely. So everyone, make sure that you download this. I will definitely download it. And then we can find some exercises on your Instagram as well, you mentioned before. Good. Let me just get, there's one more question. Um, and then I will let you go, I promise. Oh, okay. This is an interesting one. To what extent are Pilates exercises different from Schroth method?
Yeah, so this is a good question. So there's some overlap, I would say, and there are many practitioners who practice Schroth and Pilates. There is
Hmm.
also Pilates courses for scoliosis
Hmm.
specifically. I would say that we share goals of creating a good postural alignment and neutral spine. Where I would say that maybe Pilates as a pure practice, not talking about a practitioner who does scoliosis, Pilates for scoliosis. I'm saying general Pilates as if
Yeah.
you went to reformer class,
Hmm.
etc. They have training of, you know, working with stabilizing the spine, but not always have the specific training for the curve itself and how to develop the alignment. So with Schroth, we tailor the exercises to the person's curve. So we may choose a different setup of the exercise based on their curve. So we may prop them to derotate certain segments of the spine, or we may cue them to expand more the ribs on one side into where they have maybe their concavity side. Whereas in Pilates, it's more of a general elongation, which is great.
Hmm.
We teach elongation and Schroth as well, and it's stabilizing, but not as much specific to the curve itself, unless, of course, you're working with a provider who has that training.
Yes.
So I would say that we overlap in terms of developing stability, which is fantastic. And
Mm.
I do encourage um, my patients who enjoy Pilates to continue it because I think it's so beneficial.
Mm.
But there are some differences in terms of how we cue and how we maybe position the client when they're doing their training.
Yeah. Yeah. Absolutely. Lovely. Thank you so much for sharing all your amazing wisdom and knowledge. And yes, as always, it's great to talk to different people who've got different approaches. We all have, different experiences. And for me, it's so important that we keep the conversation going and we talk to each other and we share what works best. And ultimately, we all have the same goal of helping those that have scoliosis. So
Absolutely.
thank you so much. And yes, everyone get Beth's guide and yeah, keep in touch.
Thanks, Christine. Have a good one. Thank you, everyone, for your questions.
Thanks.